Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the different types of rhinoplasty. There are different classifications that you can use over here to classify the types of rhinoplasty. We'll talk about what are some common examples or indications under each type and what are some common procedures done under each type. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So we have four classifications today that we will be following. Now, the first classification that we have is based on the purpose. What is our purpose when we are doing the rhinoplasty? Second classification is going to be based on our surgical approach. Third classification is going to be based on the timing or if there is any previous surgery over here. And the fourth classification is going to be based on the extent of correction that we are going to do. So, under the first classification based on purpose, we have three types over here. We have a cosmetic or aesthetic rhinoplasty, we have functional rhinoplasty, and we have reconstructive rhinoplasty. Under the second classification, which is based on the surgical approach, we have two types. We have the closed or the endonasal rhinoplasty, and we have the open or the external rhinoplasty. Then, based on the third classification, which is based on the timing of the surgery or if there is any history of previous surgery, it can either be a primary rhinoplasty or it can be a secondary or a revision rhinoplasty. And lastly, we have the extent of correction. With this, on the basis of this, we can divide rhinoplasty into two types. We have reduction rhinoplasty and then we have augmentation rhinoplasty. So let's talk a little bit about each one of them. So first classification we have based on the purpose. So what is the purpose of rhinoplasty that we are doing? So our first type here is a cosmetic or aesthetic rhinoplasty, meaning the primary indication over here is for cosmetic improvement of the external nose appearance of the patient. So here the patient's desire and motivation for a cosmetic improvement is the main indication. These cases, it is very important that you do a very thorough preoperative assessment and a psychological evaluation as well, and document, which you should be doing in any way in any cases. Do photographic documentation of the case. In these cases, you have to be very aware of are the patient's needs or expectations that they have from the surgery, is it realistic or is it like they have a very minor deformity but the image in their head is too big. So it is something that you have to make a judgment of, like whether the realistic expectations are there or not. Mostly, the common indications for cosmetic rhinoplasty are like having a dorsal hump. Now, a dorsal hump can either involve the bony vault, which is the nasal bone area, or the cartilaginous area. So we can either have a bony hump or a cartilaginous hump. Or if the patient has a broad nose, maybe at the level of the nasal bridge or at the level of the ala, or the patient has a deviated or a crooked nose, or some tip deformity like a bulbous tip, or other deformities like a saddle nose, or if the patient has a large or a small nose. These are some examples of indications of cosmetic or aesthetic rhinoplasty. And the common procedures done here are doing a dorsal hump reduction, tip refinement surgeries, osteotomies, and alar base reduction. Our next type, based on purpose, is a functional rhinoplasty. Now, as the name suggests, this is a functional one, meaning we are correcting some functional problem over here. And the functional problem that we correct here is basically nasal obstruction. So, if any kind of external nasal deformity is causing a nasal obstruction for the patient, now this becomes a functional problem. This is not a cosmetic problem anymore. So, this will be termed as functional rhinoplasty. Now, this can even be something maybe like maybe there is something involving the nasal valve area. If there is a nasal valve collapse, that will lead to nasal obstruction. Or if there is alar collapse on inspiration, or any kind of deformity which is somehow causing an internal airway obstruction. The common indications here are usually valve collapse, nasal obstruction, or septal deviation, which is affecting even the external nose. The common procedures done here are rhinoplasty is very commonly combined with septoplasty, and that is called as septorhinoplasty. We also use spreader grafts and valve reconstruction over here. So this is a little bit about functional rhinoplasty. Then we have a third type, which is reconstructive rhinoplasty. Now, as the name suggests, we are performing reconstruction of the nose. Why are we doing that? We are trying to restore the nasal form and structure and function after there has been some kind of a tissue loss or a deformity. Now, it is very common to see this in especially in cases of post-traumatic cases. You'll see there is some kind of external deformity, or maybe their patient had some kind of a large tumor, and after excision of the tumor, there is a large defect left behind. Or if there is any congenital deformity in the patient, or a cleft nose deformity, or even in burns and infective cases. So here we are reconstructing the nose, and we are trying to restore back the normal nasal form and function. This involves rebuilding three layers of the nose: the mucosal lining, the osteocartilaginous framework, as well as the skin cover itself. And this can actually require a lot of grafts. You may require cartilage graft, bone graft, or even regional flaps. So these are our three types of rhinoplasty based on the purpose of rhinoplasty. Next, moving on based on surgical approach. Now, this is the most common classification that is followed. We have two types over here. Our first type over here is the closed type or the endonasal rhinoplasty. Now, as the name suggests, we are basically going within the nostril and we do not give any kind of an external incision. So, all the incisions will be placed entirely within the nostrils and there will be no external scar. However, the indications of closed rhinoplasty are limited. This is only done if there is a minor hump reduction that needs to be done or very simple cosmetic correction. For very extensive deformities, we would prefer to do the open approach. Now, what are the advantages of doing a closed rhinoplasty? Advantages are, the first one is very obvious because we do not have an external incision, so there will be no visible scar, which is a very, very important point over here. Second is there is a reduced operative time in these cases, and also the patient will have a faster recovery and less post-operative swelling in these cases. So these are the advantages of performing a closed rhinoplasty. Now, there are some disadvantages here that this approach will have limited exposure and visualization as compared to the external approach. And it will also be very difficult to do this approach in case of very complex or extensive deformities. So we have to, on a case-to-case basis, make our own choice about whether we want to do a closed rhinoplasty or if the patient will benefit better from a open rhinoplasty. So our second type here is the open rhinoplasty or the external rhinoplasty. So here, as the name suggests, we give an external incision. However, the external incision also that we give is actually quite small. It does not make a huge scar in itself. So we usually use the transcolumellar incision. We'll have a separate class where I discuss all the different incisions that we use in rhinoplasty. So this transcolumellar incision is the common incision used here, and this is connected to bilateral marginal incisions. And along with these incisions, we get a wide exposure of the nasal tip cartilage and the entire nasal framework. Now, the common indications of performing an open rhinoplasty is definitely revision cases. We definitely prefer an open rhinoplasty for revision cases because these cases are way more difficult. So you're bound to come across more maybe scar formation or fibrosis. So revision cases are preferred to be done via the open approach. And in cases of severe deformity or complex tip deformity, or if there is any complex reconstruction required, which needs a lot of grafting. So these are some common indications of open or external rhinoplasty. Next, looking at the advantages of this, we have an excellent exposure of the osteocartilaginous framework through this approach, which is why we prefer it to do the complex cases through this one. And we also have a precise graft placement and we have better tip modification in this approach. Next, coming to the disadvantages, there is a small disadvantage here that we do get an external scar. However, the scar is usually very minimal. It's a small scar in the columellar region. And this surgery requires more operative time and it also has more edema. So this is about our second classification, which is based on surgical approach, where we divide it into closed and the open type. Moving on to our third classification we have, which is based on timing or if there has been a previous surgery or not. So our first type here is primary rhinoplasty. Now, as the name suggests, this is the first rhinoplasty surgery or operation that is performed on the patient. And the second type is the secondary or revision rhinoplasty. These are cases where the patient has already had a previous rhinoplasty and now you're performing a revision surgery to correct any residual deformity or any functional problems that have been left behind. Technically, actually, this is one of the most difficult rhinoplasty procedures to be doing. And in these cases, the donor tissue as for grafts may also be limited because depending on what has been used in your primary surgery. And you'll also encounter a lot of scar tissue. So these are usually very difficult cases. And some common causes for performing a revision here are over resection of hump or inadequate tip refinement or collapse of nasal dorsum and asymmetry. So these are our third classification, which is based on whether there's a previous surgery or not. Then last of all, we have our fourth classification, which is based on extent of correction. Now, what type of correction are we doing? Are we reducing or are we adding? So, based on that, our first type is the reduction rhinoplasty. And as the name suggests, here we are aimed at reducing the size of an overly large or a humped nose. This is actually the most commonly performed type of corrective rhinoplasty. For example, hump reduction or narrowing a broad nose or refining the tip, where we are basically reducing. This is known as reduction rhinoplasty. And second, we have augmentation rhinoplasty, where we are aiming to increase the projection or size of the nose with the help of grafts or implants. Now, usually, this requires us to take some graft. The most common place or the most preferred place is usually the nasal septum. Then we also have ear cartilage, iliac crest, olecranon bone, or the rib cartilage. And the common examples of augmentation rhinoplasty are done in saddle nose deformity or post traumatic collapse or congenitally flat nose. So that's about the different types of rhinoplasty, the four different classifications that we follow, and what are some common examples of each one of them. I hope you have understood this. I'll see you in my next class. Thank you.